Well, it's been a couple of months since we aired the story by Ridwan Karimdini Osman and started this campaign. Let's see if we've made some progress. Joining me in the studio for more is Joel Ayim Darkwah. He's a programs officer with the United Nations Development Program, UNDP. Thank you very much for joining us and good morning. So since we launched this campaign, do you reckon that enough has been done?
Okay, thank you very much for this opportunity. And if I may, let me give a bit of background of the campaign that we have been doing, and then I can come straight to your question. So the campaign that we have been embarking on is under the bigger umbrella of what we call the Ghana Waste Recovery Platform.
Okay.
And under this platform, we are doing a campaign targeting at four thematic areas. The first theme is to project the important role of the waste collectors and the pickers, as you saw in the documentary. And then the second theme is focusing on mobilizing PPEs to support them to be very protected in this period. The third theme is looking at how we can share information on how people can get themselves well protected in this period and how they can safely dispose the tissues, the gloves, the face masks that we are using in this period. And the last theme is looking at the long-term issues on how we can reduce waste, we can recycle and all. So coming to your question, in terms of the response, I think gradually we are getting some feedback. We are getting feedback that people are now recognizing that waste collectors and pickers are very essential in our general environment. And through that, we've even had some organizations who have come on board to donate various PPEs to support the work that they are doing. For example, just yesterday, an NGO called the Brota Foundation came to donate some PPEs to support the work they're doing. And then lastly, there's a general understanding in the communities that people in the households, in the various homes, have a very critical role to play. And it is therefore important that we segregate the waste that we generate in our households. So far, that is important that we segregate the waste that we generate in our households. So far, that is the sort of feedback that we've been getting from the campaign.
From your research and the work you've been doing, what are some of the key overlooked risks that continues to thrive despite the ongoing awareness?
Well, I would say that one of the key things is that people are not wearing masks. And then people are not. Yes, we are practicing social distancing. People are not disposing the mask the way
it's supposed to be.
It's supposed to be. So, for example, once you use the face shield, the tissue, the gloves, the face mask, you need to double bag it in a separate rubber before you dispose it in a container, so that when the collector comes, they'll be able to know that, okay, these are potentially infectious waste that has to be taken care of very well.
Okay. Specifically, what national response do you think must be taken to address the disposal of COVID-19 items?
Okay, I would talk about a few things for the national response. And for me, the first one, which is very important, is change of human behavior. As individuals in our households, we need to change our behavior. We need to segregate the waste that we generate in our households. Do you think that people are well informed? Yes, that is what we have started. And I think that we need to increase the public education. Right. The second point I would recommend is enforcement. We have been talking about enforcement, how people can apply the laws in our various households. Maybe there is the opportunity for us to start looking at different ways of enforcement. For example, increasing public education to the extent that I could be the watchdog for the next person in my community, involving communities in enforcement. That could also be a way that we could go. The third point I would recommend is a high investment in infrastructure. And here we need to really bring on the private sector to encourage them to invest highly in infrastructure that we can use to manage the potentially infectious waste we are generating.
All right. Thank you very much for speaking with us, Joel